Hi, everyone. Welcome back to High Impact Growth. I'm Amy Vaccaro, your co-host for today's show. We've got a really exciting episode today. We are wrapping up our series about Dimagi's 5-year strategies. Today, we're focusing on our first strategy, which is improve jobs to improve outcomes. And in some ways, we saved the best for last. This is one of the bolder strategies that we have laid out. And I'm really excited to talk through it with you today with Jonathan Jackson and Dr. Neal Lesh, our Chief Strategy Officer. To set the tone, I'm going to start by reading an excerpt from this strategy. So it says, to get to quality and equitable care for all, we need to further professionalization of frontline worker roles and integration into our greater systems and the ability to have career growth. Over the next 5 years, Dimagi will expand upon our historical strength by deepening our commitment to frontline workers and by actively contributing to the improvement of their jobs. So this strategy has been a long time in the making and actually dates back, I would argue, to sort of the earliest days of Dimagi. So I want to today talk about the story of how the strategy came to place, why it's so important, why John and Neal are so passionate about it, and really kind of start at the beginning. So I want to first go to you, John. From the very beginning at Dimagi, I believe it was episode 2, where you tell the story of our first project in Zambia, which is a national medical record system. And you talked about really focusing on how can we make sure what we're doing is actually helping the workers that are having to do extra work, right? If we're building up a digital tool to allow data collection, making sure that data actually benefits the people collecting it. Can you say a little bit about those early days and how you've been thinking about making users' jobs better?
Yeah, I think the original way in which this manifested in our early work was not on an absolute scale, which is what our current strategy is talking about. And I'll get to that later in the episode, but was just relative to other digital tools. We were out there in the field seeing a lot of people create software solutions that were purely data collection and given to users without a lot of thought or care as to how it might alter their job, how big of a burden it was to do the data entry, and what the ask was on the frontline worker. And my early personal experience, along with many others in the field of research at that time, but also at Dimagi, were witnessing this, and you could already tell that you were making the job of the worker worse. You know, they still had to fill out the paper forms, they still had way too many patients to see, and you were adding this digital tool, which maybe theoretically would help, as decision support, organizes the job a little bit, but you weren't actually doing the hard work to get rid of paper. You weren't actually doing the hard work to make it more usable and save that person time. And so that's where a lot of my early philosophy came on how we needed to think just about a design process at Dimagi. But that was from a lens of, can we make Dimagi software sustainable, right? It was like starting with a focus on us and figuring out, well, what needs to be true about the world in order for our software to create impact and be sustained. And over the years, we worked a lot, with Design Under the Mango Tree, and that's really our philosophy about getting out to the front lines and helping users and watching them use our software. But more recently has really flipped that, and it's a much better articulation and philosophy aligned to what we always had, and getting back to our roots, but really focusing on the worker as the end goal, right? Like, can we make her job better? And if we've done that, we've done enough. And then there's all these other things that are going to be great, primarily creating better impact. But if her job gets better, there's a really strong correlation given the workforces we go after targeting: community healthcare workers, agriculture extension agents, primary care providers, nurses, doctors, et cetera. If their jobs become better, we strongly believe there's a high likelihood that directly leads to more impact. And we've proven that in a lot of our research as well. So that's where a lot of this came from. And I want to thank Neal, my Chief Strategy Officer, and my Chief of Staff, Jillian, for when we were doing this work together last year. They have the joy of working with me a lot on written documents, and sometimes I will have an idea in my head that I can't quite get out. They'll take it past a document. I'm like, no, that's not it, or this isn't that, or like, I have no idea what you're talking about. And we were talking a lot about the frontline worker. It's always been our focus, always been what we wanted to prioritize. And then through a series of conversations back in August, one of them, and I can't remember who, just kind of landed on, are you talking about their job or impact? And I'm like, it's both. It's we got to make better jobs because that's what's going to make better impact. And if people don't want these jobs, we're kidding ourselves that we can scale these health systems with jobs that are undesirable, unrespected, underpaid. And that's really what this came from. And that's why we're so excited and proud to be carrying this message forward. And it's something that we've always felt, but not something we've been able to articulate, I think, this clearly.
That's great. And Neal, I want to hear from you. How did you come to this realization as well? I think you've had your own journey with this particular strategy.
Yeah, echoing the points that John made in the early days, there was a lot of focus around making usable apps for frontline workers. Like one of the early formative examples was, I think, in Uganda, and we were digitizing a home visit form. And the first question on the paper form was about the sanitation of the house. And it would say, like, is your toilet clean? And so we digitized that. And that was like the first thing that pops up on the mobile app. And then the users gave us very immediate feedback that this was totally unusable because that's an incredibly rude question to start a conversation about. And, we said, well, it's the first question on the paper form. And they're like, yeah, that was designed in, Washington, D.C. And we just skip it and we ask it last. In a paper form, you could jump around, but on the digital app, you can't jump around that way. So that was an example where, a simple example of the kind of like creating a usable app that isn't obvious just from digitizing even when you have like a paper form. That's the starting point. And we argued a lot with partners, like people paying us to build these apps to give us more time for that iteration. We said, you've got to try it, see what works, doesn't work, get feedback, build trust with the users, have them see that the suggestions they make go into the app the next time they use it, which will spark more ideas. And we'd kind of negotiate for as much of that iteration time as we can get. So on that part, this was sort of like a point that really connects to the current focus on improving jobs. But some parts are really new. Back then, there were whole areas that were clearly of high concern to the workers that were totally out of our jurisdiction. So like we would start usability sessions with workers and we'd kind of like try to get a sense of how we could help them do their jobs better. And we try to frame the question to like avoid what we knew was going to be the first thing people would talk about is like, we need to be paid more or we need better supplies. And then we'd like acknowledge that and say, yeah, we're sorry that like we can't help with that. We're just like seeing whether we could help with better digital tools. And, it's really very exciting now to be taking a wider scope and thinking about making the whole job better, growth opportunities to get paid more. That's really a big change. The current state that we're going to say like that is now in our jurisdiction and things that we're going to try to do.
That's great. So I want to kind of dig into some of the ways that we're making the jobs better. But before we get there, I did want to share, Neal, you found a really interesting document from 2016 where, it looks like, you and John were starting to really articulate this strategy before it was external in any ways. And you wrote, we want frontline workers delivering services in the most challenging areas of the world to be better supported. And then you talk about ways that we can, could we help them with better supervision? Could we help them with automating some of the decisions? Are there ways to create an identity for a frontline worker so that we can be adding new services and new tools to their arsenal? Can you talk a little bit about that early thinking around this strategy?
I had a lot of fun. Neal sent this morning, actually, when we were pulling background material for this podcast. And it was a memo I wrote to the management team before our management summit back in 2017, I believe. And 2016 was a pretty substantial year. It's when a lot of our national scale work kicked off and was causing a lot of stress at the company. And we knew from our experience even back then, and certainly that's what's driving part of the strategy now, and we've talked about it in prior episodes, the demands on frontline workers are substantial, and people just seem to keep adding more work to their plate without offering more pay and without offering more training and more supervision. And we knew, even as we were going towards national scale, that it was going to be really important to figure out, once at national scale, what are we going to do? And how are we going to support the government to support the frontline workers? And that's where a lot of these ideas around what does a better job for better outcomes look like. And one part of that's definitely going to be pay. One part of that's going to be better digital support. One part of that's going to be better human support. And that's really what I was trying to think about as we're heading into that management team meeting, because our entire year had been consumed by prepping to go to huge scale. And we then spent 5 years from 2017 going to huge scale and are continuing to do that. And we still, at the same time, also recognize how busy governments are, how overloaded frontline workers can be, and have been seeking different ways and different ideas to do that. And I'd say even before 2017, we had different members of our team trying to cracked this as well, whether that was offering direct to frontline worker educational applications to help with their own family planning or their own household engagement, or financial planning, which we've done a lot of work around chatbots and conversational agents to support digital financial literacy, which is critical. So we've always had these different elements we wanted to say, how can we be even more valuable to that frontline worker? She's got a smartphone, she's got internet, she's already familiar with CommCare. And that, was always in the back of our heads. And now certainly a core part of our strategy going forward is thinking about like, what more can we be doing to support frontline workers and so that they can create better outcomes.
Neal, did you want to jump in on that one?
Yeah, I went looking for that document because I know that John's been, in particular, kind of pushing this vision of what we need to do and what we need to get beyond for a long time. And it's been very salient that if we just stick with what our known mandate is with workers, that will be like probably not enough to like really make it all work, and definitely leaving a lot on the table in terms of what we could do. And so I think this is a case of something that has always felt, really important, but not urgent, or at least not addressable in the short term. Like it was like a little striking to me to see so much of this articulated in a 2016 document. And I think what's exciting now is that now like we're able to take it on. So now it feels like both important, but I think more urgent, and definitely something that we're gonna put our stake in the ground and raise the urgency and like the immediacy of it, partly by force of will, to make sure that we don't let another 5 years go by with the ideas that we've seen and known about for a long time.
Yeah, absolutely. And I'm feel really grateful that I have joined Dimagi at a moment when we're actually in a place to really prioritize that. I think it's pretty special. So that brings us to, roughly, obviously there's way more to the story, but to today, right, where we've actually laid this out in our 5-year strategy. I want to read just a sentence from that strategy. So it says, we will organize our work around the assumption that our vision, which is to create a world where everyone has access to the services they need to thrive, will not be realized until frontline workers' jobs are improved and we support them to be paid more. So I want to ask you, Neal, I know you were really central in writing this, as we've discussed, and it's quite a bold goal for a lot of reasons. I think I want to hear how you're thinking about it. Why do you see this as such a bold goal for Dimagi?
Yeah, one thing I'll say is this is my broad background on the type of goal it is that there's a lot of really essential things that we need to attend to make a working product and services. And there's only, one or two that you can champion. And if you look at industry, there are companies that champion customer satisfaction, not because that's like the thing they really care about. It's the way, if they focus on that, that's their plan for getting to profitability. And there might be other organizations or just companies that really focus on high quality. Like when in doubt, we'll just make high quality products, and that will lead eventually to long-term profitability. And for us, impact, saving lives and helping people thrive is ultimately what we champion and pursue, but it doesn't help you make day-to-day decisions. You can't decide this thing or that thing, and you'll really kind of like wreck yourself if you try to say, well, like, should this decision, which one is going to save more lives in the next 10 years? And so I think, the choice to figure out what to rally around and to go, was pretty obvious and just like true to our whole approach and everything we've done to centered around the frontline worker. They've always been the hero of our story. We've always focused a lot on them. That's always been a lot of our skill is our understanding and ability to equip and empower frontline workers. And then to the points John was making earlier, it was just kind of exciting and felt right to take that up to a level and really say, not that it just rang really true, that we don't believe you can get to universal health coverage, meet other development goals, unless these jobs get better. And I think you can't, there might be like other important statements like that one can make in other parts of the industry or global development, but tackling this one in particular and say, we're going to focus on it and use that to guide a lot of our decisions and what we're going to champion and put our energy towards really rang true. And it gives us a place to focus on something that we really believe needs to change in order for any of our goals to be achieved.
Yeah, and if you look at some of the stats, estimates show about 70% of frontline workers are women, 86% are not fully salaried, and study after study shows massive burnout among this workforce, like 50% or higher in a Malawi study that I saw, and I think similar results in many other areas. So you have a gender issue because these are largely women, a fairness issue because they're not paid for critically important work, and then a retention issue because they're all burning out. And that was probably pre-COVID data. And so you can imagine it has probably gotten a lot worse. So these are all factors that make this community health system, which has been proven time and time again to be incredibly high impact and incredibly high ROI when done well, to be incredibly difficult to do without improving a job. And I always give this analogy of looking at different educational systems. And when you look at trying to improve educational outcomes, you know you're very dependent on the classroom setting, and that's very dependent on the teacher skill. And so you have all of these goals to improve educational attainment. But if that teacher doesn't want that job, and not only do they not want that job today, but they want that job less tomorrow, doing an intervention to improve educational outcomes without fixing that problem seems very misguided to me.
So if the job of teaching isn't a desirable job and teachers don't want their jobs, any intervention you roll out that doesn't actually make that work better is unlikely to have the impact you want. Before you can improve outcomes, you have to improve the job so the people create those outcomes.
And similarly, in the healthcare systems that we work in, when you have this proven high impact worker who's doing this job because she's pro-social, she's trying to have impact in her community, she's already underpaid and overworked and still doing the job, not trying to leverage that person to get her more earning potential and more ability to make impact is, to me, a really flawed strategy in what is widely now recognized as a critical pillar in universal health coverage, which is enhancing these community healthcare systems.
One thing I remember from this strategy was kind of going back and forth around, do we make the frontline worker better at their job and more productive, or do we make their jobs better? And I think I remember you saying, like, this is a really big decision point, right, between those two. And this was actually when I think I had just joined, so I was still wrapping my head around it all. But I love that we actually landed on the bolder goal when it would be easier to focus on productivity, right? To look at, are we making her more productive?
Yeah. Now that we're here, it seems kind of obvious, but I remember wrestling with that as well. And the more straightforward thing is indeed to make workers more productive. And there are plenty of tools out there that make your job, annoying to use, probably make your job worse, but increase productivity. And in our context, that's like, you could do a lot of good through productivity improvement. And I think we really came to land on the short-termness of that kind of approach. Going back to John's point where we were thrashing on the ideas, one thing that kind of came up a bunch were times where we're not sure that like our intervention makes jobs better, where like the app is slow to use or they're doing paper and digital still. And on some level, depending on your goals, you could say, well, that's just part of like making progress towards our ultimate goals and improving global development. But this really gave us a chance to push against that and to say our goal is to make that intolerable and to say, no, we can't allow that. Just like in other industries, you might say, no, we can't have unsatisfied customers or we can't have low quality products. This really kind of let us just have a lot more solidarity with the users by really just saying like, no, we really want to make sure our jobs always make things more productive. Also, like we're not losing that, but in addition, actually make the jobs better. So I think we didn't have to end up there, but now that we have, it really feels right.
Is there an example, Neal, you can give of a time when an intervention we've worked on actually made jobs worse and we kind of realized that?
I'll give one example. John may have others. There are times when we've built systems that we intended to be used during service delivery, during like people's, delivery of care, and then found out they were like exclusively a reporting tool and a redundant reporting tool. Even ones that were like really didn't feel like they would be. So we had done some work where we had growth monitoring charts enabled in so you could build in ComCare, so you could enter a child's height and weight, and then we'd automatically produce these charts showing the growth trajectory of the child and whether it was matching expectations. And then to our alarm, we did some field work and found out that a variety of kind of horrifying things in the usage of it. Some were that like this was used at the very end of the process. So people already were doing the paper charts, like all this manual work, and then we're entering this in later. Other times where people hadn't realized that you could actually see the charts in the app, like that part hadn't been made clear. It was a misstep of training. Those kind of went together. And so we realized that like, oh, this was like just an added burden, at least that part of it, to people. Another one is we had tools. I guess this wasn't necessarily ComCare, but we were like building electronic partographs for managing a delivery. And a real challenge for those systems is that they're designed, like they're built to like do the early warning systems and realize that, oh, like somebody needs to go seek more care than they have at the current facility, but they get filled in only at the end after a child is born just for reporting, which really defeats the whole purpose. So that's an area where we tried to build a system in advance to avoid that problem of just adding reporting.
Those are both really helpful, vivid examples. What scares you about this strategy?
Well, I think it's big and bold and ambitious. And so what scares me is not succeeding at it. And I think there's lots of ways to accomplish what we're trying to do, and it's going to be through collaboration. I mean, that's one of the best things about the fact that we're open source and the community that we work in is everybody's highly collaborative. And I think everybody mostly agrees that with our premise. The question is, do they agree with it more than their other priorities? So I don't think anybody's opposed to better jobs, and everybody will, gladly champion jobs becoming better if they don't have to do anything. What is going to be hard is for us to build our part of the problem, which is how do we make our technology amazing at supporting this so that the people who do need to make the decisions on priorities can opt into it and can invest the right amount of time to make better jobs for better outcomes, given all we're going to invest in technology and exponential growth. And so I think that's something that is incredibly powerful, but is going to be hard. And it's also, though, I think necessary. We look at some of the healthcare fracturing we've had over COVID. COVID's not going to be the last pandemic the world faces. NTDs are growing, chronic disease is growing. There's just huge healthcare burden all around the world in all markets. And there's a massive provider shortage, 18 million by some estimates. So the gap is going to be filled by community healthcare workers and non-specialized providers in a lot of contexts. And those workers can't have a static job, right? They can't have an app we built be running 5 years later without having been changed. The role's going to dynamically change. The needs of the communities are going to dynamically change. And it's hard enough just to get these systems stood up and then not change them after you scale them. And so we not only have to do what's been difficult historically within our industry to get digital transformation achieved, but then immediately make it responsive, which is not even true of most of the project designs today. So this is a big hill to take ahead of us, but I'm really excited that we have the strategy, people, and resources that we really think we can do it.
Yeah, I think we're setting ourselves a really high standard that we have to hold ourselves to in a way that is different than I think kind of the early usability work. Like in the end, we knew if we just built a unusable system, people wouldn't use it and we'd fail pretty quickly. And so we didn't have to look that far into the future or, take a stand on something that we knew wouldn't be immediately necessary when we insisted on techniques that would let us make an app that could actually be usable. But here we're going beyond that. And I think it is necessary in the long term, but we're really going to have to hold ourselves to this standard and push for improving the jobs in the ways we hope to. And I think that part is a little daunting as well as exciting.
Yeah, that's such a great tee up to kind of where we're at today in terms of what does this strategy actually mean for Dimagi's work. And I want to read a little bit from the strategy. This will become a more prominent consideration in how we pitch projects, design apps, prioritize product features, and advocate within our professional communities. Dimagi is not the first or most eloquent organization to champion frontline workers' needs. We will continue to engage with organizations like the Community Health Impact Coalition, CHIC, that embody many of these principles, as well as leverage and contribute to larger efforts. I would like to hear from both of you, and I know that this will be kind of a series, so this isn't a one and done conversation. We're going to keep digging in on this, right? Because there's a lot of work underway on this strategy, but I want to hear what are some of the ways that we are working on this today?
One of the things that's really cool about the strategy that we rolled out is it already aligns to a ton of work that's been going on that is fully aligned to what we were doing prior to the strategy shipping. So we have one project where we're supporting campaign workers for vaccination drives in over 10 countries. And the whole purpose of that project with the Gates Foundation is to digitize healthcare worker payments because that's a more real-time payment for them. And so that already has all the pieces you need. And so focusing on learning how do you maximize the speed at which they get paid, how do you make it as easy as possible to enroll and receive those payments and really get that digital money into their hands as soon as they're owed it is a great example where that alone, makes a better job. So there's lots of projects that already have alignment, which is really cool. And then there's a lot of projects that we do need to figure out how do we advocate for different application features or different program designs that can make that job better to drive better outcomes. One of the areas that we're really excited and putting a lot of research into in 2022 is digital learning. So looking at different ways to use our conversational agent technology or CommCare itself to build apps and ways that healthcare workers can upskill themselves. And one of the projects I'm super excited about is our resilient skill building work that we're doing with Johnson & Johnson. And so this is taking content that they've been working on with many different folks for years now that help frontline workers build resiliency skills. Obviously, as I talked about previously, the burnout rate in the healthcare workforce in all environments is way too high right now. And we're trying to see, can we digitize that and still have it be effective for building that resilience skill? And if so, just making that widely available to all users. And then they, if they want to opt in, could have access to content that can help increase resiliency in themselves. And that'll obviously directly lead to better outcomes given how effective they already are. So there's a lot of those really exciting projects. And then there's a lot of important work we have to do ourselves. One of the things that I get on my soapbox about that I'm hoping to make progress on is how do we have a discussion with our partners about when they can get off paper and what would be the criteria for getting off paper. So this still happens in a ton of projects where you deploy a digital solution. Everybody was like, okay, yeah, they're on paper and both for a little bit, but then they'll get off paper. But it's like, under what condition are these users able to drop paper? What exactly needs to be true? And doing a better job making sure we support whoever the decisions makers to have the data they need to make a go, no-go decision on that, and being much more rigorous on our end of saying, well, wait a minute, if there's no path to getting off paper, what are we all doing here? Because any usability study we do where the worker doesn't say, I hate that application, it's just adding work, probably just ask the wrong questions because that's what they should think. And so that's another area that we're trying to really infuse into our thinking. And that's a collaborative process. That's not our decision, but it's making sure that the government has the data they need to decide whether they can go paperless. And that to me is a critical factor early on in decreasing the overall time that the community healthcare workers invested in data systems in general, whether it's data or digital, so that she can maximize the time she's spending with her clients. And that's something that we're also trying to make a lot of progress on.
That's great. You've just highlighted a few different projects. One where we're actually helping health workers get paid for the work that they're doing around vaccination campaigns. Another that's really digging in on training and supporting frontline workers to build their resiliency. And then additional ones where we're really having those hard conversations about just because you're launching a digital solution for a certain workflow isn't going to make things better unless you're actually taking away the paper-based workflow that already was in place. Neal, anything you would add to that around what are some of the things we're doing today that you're excited about for this strategy?
Yeah, as John said, it has a lot to do with like prioritizing elements of projects that we've already done, like making sure the apps perform well, pushing for going off paper harder than we might have before, and looking for opportunities to add in elements that are good for the workers. So combining two of the things that John said, we're going to be offering that resilience building app to some of the polio vaccinators who we were brought in to do helping to digitize the payments for. And so that's an example where we are like adding in elements that we hope will build resilience, make jobs better, and that's really guided by our focus on this priority.
So John, you talked about the importance of collaboration, right? That this is a scary goal, scary that if we fail, but you also said that there's just a really strong community around this work. It's not just us. Can you say more about some of those other players?
Yeah, we mentioned the Community Health Impact Coalition. That contains a lot of people who are implementing amazing community healthcare programs. There's a lot of governments in the global goods community that we support.
Quick sidebar, global goods are open source digital health tools that are adaptable to different countries and contexts, and CommCare is one of those.
So a lot of folks are not opposed to better jobs, as I said. I mean, in fact, champion them. The question is how to create better jobs along with all the other priorities we have. And I think that's where the conflict could come in. And that's really where we're trying to be a loud voice in the community, advocating for ways in which better jobs can lead to better outcomes that don't necessarily have to compete with other priorities, but are synergistic and accomplish both at the same time. If you care more about data than better jobs, well, making the app better solves both. If you care more about health system coverage than better jobs, well, paying more for more service delivery solves both. So there's a lot of ways to accomplish both goals. And I think that's something maybe that we can hopefully uniquely bring value to, both as a technology platform, but also just as a philosophy and the way that we're trying to advocate. But there's a lot of people out there who are very strongly championing for community healthcare workers and healthcare professionals in general. In fact, most people in our industry. So we're certainly not going down this path alone. But I think among the digital technologists, we are bringing that unique voice and are very excited to.
Yeah, I'll say one of the things about this is that we're really doubling down on a theme that's getting more and more recognition and attention. So I think just even very, very broadly, there's more appreciation for the roles of essential workers across all parts of society than there were a few years ago, and a sense that it's something you can't just totally neglect and that we all depend on a lot of people. And that this fits in, really broad kind of trend in society, as well as I think it's more and more commonplace to say we can't just keep piling more and more responsibilities on the frontline workers, that's at the breaking point. That I think is a well understood and recognized aspect of things. So I think we're part of a general trend and getting a lot of support from the community, as well as trying to play a leadership role to really accelerate and emphasize this point.
Thank you both for this conversation. I think this was really insightful for me and hopefully the audience as well. In the very first episode of this podcast, our teaser trailer episode, at the very end, I mentioned something about new things we're working on that are going to change the world. And that ties into this conversation. So there is a lot of work happening today and a lot of thinking going into this today. And beyond just the projects that John and Neal mentioned, how can we really make an impact on improving frontline worker jobs? So I'm really excited to, in future episodes, to share a bit more about some of that thinking and some of that very, very early work.
Yeah, I think there's a lot of exciting ideas we have been thinking about previously that are now in a really fortunate position to build out around how do you support a frontline worker to choose her own activities and how she can best contribute to her community. And we kind of call this direct to frontline worker in terms of enabling the government or enabling a funder or enabling a local NGO to create the autonomy and ability for a frontline worker to opt into the activities they want to provide to a community. And that may not be all of the activities she's doing. Maybe, half of the job is prescriptive and is standard. But for the other half, maybe some communities want to focus more on diabetes screening, or some communities are focused more on TB case finding, or other communities are doing vaccine drives. And the way that we design current systems with this big one-size-fits-all approach at national scale doesn't allow us to be responsive and adaptive, as we talked about earlier. And so I think this notion of how do we unlock the choice and the power of frontline workers can be a great way to both scale health systems, reach universal health coverage, and improve jobs to improve outcomes. So there's a lot of thinking we're doing around that area, and we'll hopefully have some exciting research and technology to talk about in future episodes.
Yeah, we have some really new and interesting innovation ideas that we're formulating. And I'm really glad that we spent so much time on the kind of strategy and the goals last year before landing on these particular innovations. One of the common kind of critique of our kind of work is that you build hammers in search of nails, and you get really attached to the innovation or the hammer, and then want to apply it to everything. And I think in this case, we really did define the goals and what we were trying to do, knowing we didn't quite have the full innovation we were going to try to go after it with last year. And having done all that work gives me kind of more comfort and confidence that we're doing it for the right reasons and to really try to attain important goals rather than just getting kind of caught up in the cleverness and the fun of the new innovation.
I hope you enjoyed that. I'll share a couple of my key takeaways. So today we heard about what's so unique and bold about Dimagi's strategy of improving jobs to improve outcomes. You heard the story of how we came to the strategy, how it was part of Dimagi's thinking from day one, and how we decided to prioritize it now. One of the things that I think is so exciting about this strategy is just how fundamental it is to achieving universal health coverage. Frontline workers are becoming more and more overburdened, and they're a really critical part of health service delivery globally. But they are underpaid, undersupported, underrecognized. It's really, really tough work, and it's getting harder and harder. And frontline workers, in particular community health workers, are an essential component to getting everyone access to the care they need to thrive. And so if we want to expand that workforce and expand what they're capable of, we need to make those jobs better. You heard a little bit about some of the projects that we're working on that touch on this. So we're working on digitizing healthcare worker payments in 10 countries with support from the Gates Foundation. We're working with community health workers to help build resilience skills with support from Johnson & Johnson Foundation. And you also heard a teaser for some work that we'll talk more about in future episodes that we're working on now, where we're thinking more deeply about how can we more directly improve frontline worker jobs. In our next episode, you're going to hear a deep dive on collaboration, how we approach it at Dimagi. What does it look like to do collaboration well? What does it look like to fail at collaboration? What does that look like internally for how Dimagi operates? And we'll be joined by Dimagi's Chief of Staff, Jillian Jabetsky, for that episode. Thank you so much for listening. Please take a moment to rate, review, subscribe, and share. It really, really helps us grow our audience and our impact. And if you have ideas, feedback, questions, anything, send them to us at podcast@dimagi.com.